Hey, Haroon.
I know. Wow, I didn't know my picture was going to be here.
Yeah, you're good.
All
I'm
right.
so excited that you're joining us. Hey, we're
Is that,
being joined live by Dr. Haroon Mojaddidi right now, and wanted to talk to him because he's been out there working tirelessly on the front lines. We want to know what's going on, so give us an update. Give me your background a little bit, just so people can understand who I'm talking to.
um, I'm a surgeon by trade, I guess, and doing this almost 20 years. So I'm pretty much in the ICU and in the ER. So I see quite a bit of the initial and then obviously the course of the patients throughout their hospitalization.
So as a surgeon, though, have you been doing a lot of surgery, or are you just dealing with what's going on right now with all these patients?
Well, unfortunately, we've probably in the last week turned down a lot of our elective cases that can wait 4 to 6 weeks, but we are unfortunately still have to do the sick patients that are in. And there's the emergent cases, which obviously have to go, and then there's the urgent cases, which we try to squeeze in, but obviously anything elective is on hold for 4 to 6 weeks at this point.
Wow. You're normally doing heart surgery, right? Or are you general surgeon?
I'm a general surgeon, so pretty much, trauma and general surgery is
Oh,
what I
okay.
do.
So all of that's kind of on hold right now, and you're doing.
Well, the trauma stuff still has to go and the emergency stuff has to go, but some of the elective stuff, sure, from the office base that can wait. But you have patients who are dealing with cancer and whatsoever that are on hold, so that adds to their anxiety. And
Wow.
mainly the goal is because preservation of our supplies.
Wow. So
Yeah.
how many hours are you working a week right now?
Oh, 60, probably 60 to
Wow.
60 to 80, depending on the week, because what we're starting to see is a lot of fatigue, and not necessarily physical, but mental fatigue. So people are just needing a break from their normal stuff, because the normal 8-hour to 12-hour day is way more stressful now, because every patient is a potential contact. You understand these people are human and they've got families, so every encounter they're going into, they're kind of like risking potentially spreading it to their loved ones as well. So we see quite a bit of kind of mental fatigue.
Well, I specialize in anxiety-based disorders, and I'm trying to educate people on managing anxiety, and I've been trying to get as much information out there. But for you right now, I'm sure that you guys are dealing with a lot of anxiety. And what are you seeing at the hospitals?
Well, I think a lot of it's the unknown. It's definitely a different playground. The mood is different when you walk into every hospital. It's just everyone's a little bit on edge. And I think the scary thing, at least for the medical professionals, is that we all have not necessarily anecdotal data, but we have people who are in New York and in some of these hotspots that are really feeling the crunch. And you're just trying to mentally prepare for that situation if it happens here. Like New York is horrible. New York, and I have friends in New York, but also here in Santa Clara that are stressed because the resources are being used up quite a bit. The supplies are. And this testing turnaround time is horrific. We're waiting 3 to 5 days for a test, which means those patients that we're waiting to confirm whether they're not, is every day is a consumption of all these barriers and stuff that we have to use. But on top of that, these patients are waiting for potential whether they're positive or not, because that uses resources. And every day we get more and more. So your ICUs, your floor beds are being occupied by all these patients waiting for tests.
Wow. And you're in California, Northern California. Are you in the
Northern
Sacramento
California.
area?
So
Okay.
our area itself is not, but I'm actually, because I travel a little bit, so some of the areas are starting to feel the crunch.
Okay.
And it's funny, we walk in every day and we're allotted one mask for the day. It's like you have to go and get it rationed. Not like before where you could just grab it out of the lockers or wherever. Now it's actually being rationed.
Wow. I know that there are a lot of people not taking this seriously and not feeling it. And I wanted you to come on and kind of talk about why to take it seriously and why people need to make sure that they're following the rules so that you guys could do your work.
I mean, I think the biggest thing is to know that this is essentially, the symptoms are pretty vague. Cough, maybe a fever, maybe body aches. These fall into so many different categories that, like they say, you're walking around for quite a bit of time as being asymptomatic, as they say. You're walking around with like a silent thing that you're holding on to. And then even when you do start getting the symptoms well into where the virus is actually starting to take over your body, it's still non-specific. So I think the potential is that you may recover, but you don't know potentially what you're a vector for. You could be the vector for the poor guy who's standing behind you in line and getting gas, who's 80 years old, who's going to go home and get it. And I think that's what you have to be cognizant. I mean, our approach is, knock on wood, I don't think I have it, but I treat myself as having it every day when I walk into the hospital, because everyone in there is susceptible.
Right. Right. So what are some of the symptoms? Because like you said, they are vague. And if somebody thinks that they do have it, what should they do?
I mean, I think the one thing when I ask my colleagues is persistent fevers, because the initial, the runny nose and stuff could be anything you get. But I think when you start feeling fevers is when you should be starting to get a little concerned. Persistent fevers that are escalating with associated body aches, and then the dry cough. Those are the top three that we've seen. Now, patients have reported headaches, backaches, all these other things. But I think if dry cough in combination with a fever and body aches, you should be on high suspicion for it. And
if you have that, what should you do? Should you rush to the hospital, or what else?
No, I think you're potentially, if you're able to control your symptoms, you just kind of self-quarantine yourself, be very cognizant about who you're around with, and protect those around you, and not go to work, and quarantine yourself. And unfortunately, if you start to have the fevers are going up, or you start getting short of breath, or you feel like this heaviness over your chest, then you should contact your primary care physician. And every primary care physician has certain protocols and triggers now. So those would be the first outlets, because you don't want to overwhelm the ER or urgent care right now unless you have to. So your primary care physician should be a good source about what are the next steps. And every county is different. The testing is really all over the place. Some counties are using county researchers, some are using private entities. And unfortunately, a lot of the data that's out there hasn't necessarily accounted for the private labs yet. So our numbers can dramatically go up.
That's what they're saying. This week is supposed to be a turnaround week, or it's going to show up, it's going to be more dramatic this week. So what are your thoughts about that?
Well, today, right, we went to 10,000 from yesterday to today nationwide. So some of these labs are starting to come back. Now, it'd be more interesting to know those numbers. It would make a lot more sense to people about, out of those positive, how many people are actually inpatient versus home. Because we still know those are positives, right? Because people can come into urgent care saying, hey, I'm worried about it, but I think I can control my symptoms. You don't need to be admitted. Go quarantine. We'll test you and we'll send you the results. So there are people out there that are home positive, but they're not necessarily using resources. And that's the important thing, is if you can control your symptoms and ride this out, and you're luckily some of those mild cases, it's better to be at home than in the hospital.
So what does it look like in the hospitals right now?
Well, every hospital's gotten into their major disaster plans. They've all opened up tents and triage and figuring out ways to identify these patients before they even hit the door. So if you're concerned about this, is triaging and fast tracking these people away from the normal population, because we still have tons of people that are coming in with other things. And that's the other thing to remember. And I think this is the part in Italy, is their researchers are being so consumed that the natural emergencies that we normally have, strokes, heart attacks, and death, are also being kind of compromised. So we don't necessarily, the overall impact to healthcare and some of these numbers is not suggestive, because there are people who potentially are not getting the care that they were.
Oh, wow. So are you noticing that, is there a sense of panic, or is it pretty calm in the hospitals? Is everybody kind of falling into the routine?
I think, people are trying to take it out as a group effort and put on their best faces. But I think the more and more hours you spend in there, you can get caught up. And most of my physicians' friends say they seem like they're starting to get some of the symptoms while they're in the hospital. It's almost like this anxiety that, wait, do I have this? Do I have that? And that, unfortunately, can add to the level of anxiety. But as soon as you leave that realm, then you're a little more safe. And then this constant, it's our natural workflow is being altered in a lot of ways. And as you all know, that anytime there's change in the workflow and what you do, is for potential things to fall out of protocol and get accidents to happen. So if you're not used to wearing all this, the gear that we constantly have, your breathing difficulties and all these other things, you just are not natural. So you're on edge just because there's been a big change. And we also know change is one of your biggest kind of risk factors for anxiety, right? When suddenly things are not beyond your control.
Well, also stress will actually weaken your immune system and make it more likely for you to catch the disease, or any kind of sickness. So what are your recommendations as far as how people should be handling this?
I mean, I think, you know, they tell us in terms of, for the physician's well-being is for us to be rest in between your shifts, take care of yourself, eat right, because that in itself is adding to the stress level on your body, because we know there's the mental stress, and that you just have to step away. You can't work consecutive shifts. You have to kind of get a sense of what it's like outside of that hospital, because it can get a little taxing. And I imagine for patients' sake too. And I can't imagine a patient who's positive in the hospital having all these, and especially shortness of breath, which is one of the biggest triggers. I mean, that's how a lot of anxiety patients trigger, is short of breath, right? They get kind of anxious. And so these are immediate triggers for some of these people. So in the hospital, I couldn't imagine being a patient and having some of these symptoms and thinking about all these implications that, am I the one that's not going to do well? Am I the one that's going to die? Am I the one who's going to be the healthy young person who succumbed to this disease? Because we're starting to see samples of that.
Wow. Yeah, and then just that mental stress that you said, and people, like you said, that 70% of hospital visits, emergency visits, tend to be anxiety related, right? They go in there thinking they're having a heart attack, and it's really panic related and it's emotional. How are you guys managing that? Are you seeing a lot of people that you need to turn away because they're just clogging up the system?
Well, you're trying to fast track those, and that's where we're relying on, you know, nurse practitioners, certain protocols, and even retired physicians, and even certain physicians who are normally used to doing surgery are being asked to do some of these other things just to help out, alleviate the stress. And the ones that don't need to be there shouldn't come. And I think you really have to think hard and fast about, do I really need to impact the urgent care of the ER at this point with some of my complaints, which we don't want to say is trivial, but in the context, they may not be as important as some of the things they're dealing with.
Are you seeing a mental health unit on the, you know, at the hospitals that you're at? Are they active at all? Or
as you know, mental health is one of the most underrepresented in terms of resources in the whole country. I mean, we've had people bordering 3 or 4 days in the ER waiting to go to a psych facility. So that in itself is a stressor, not having that. And I can't imagine people who have mental health disease, if they get caught up in this scenario, and this is anxiety provoking, knowing the limited resources, especially on the inpatient side, also on the outpatient side, how they're affected.
Yeah. How are you taking care of yourself and managing to balance out family and work right now?
Well, I mean, I was talking to a friend of mine who's basically, some of us, unfortunately, you kind of have to be a leader in the sense, and you have to set the tone so that people are try to get some of the anxiety and stress away and try to keep things in perspective, and understand that people are, and talk about it, and really get people to open up rather than people just walking around, because these masks are definitely not part of, and the social distancing is keeping people away and not interacting as much. So that in itself is stressful when you can't communicate some of your concerns, especially in the hospital setting.
Wow. So how are you taking care of yourself at home?
Me, I'm just enjoying my time. I'm, trying to, obviously, homeschooling, which is a lot of us parents are doing now at home, which can be anxiety provoking, especially for some.
Having all of them home?
Yeah, so you try to do your best at home and try to think away. But, it's certain physicians, and unfortunately some of these positions we're at, it's not necessarily constant conference calls, because this is such a moving target every day that things change. Like just this morning, we had an email and said, no surgeries at all, unless absolutely life-threatening. And then at noon, we said, no, it's okay to do certain things. So it's a moving target. And I don't want to be in the position of hospital administrators and those people who have to make these decisions, but I think it's such a big unknown, and no one's really prepared for this disaster planning. And even if you have nothing to this capacity. So I think we're all trying to do our best, but it's not constant emails, conference calls about what's the next step.
How long do you think this is going to last? What is your understanding from your end as far as how long we're going to be inundated like this?
Well, I think the next 2 weeks is huge once we have massive testing, because I think the biggest problem we have is we don't know our denominator. We know the numerator in terms of what patients get sick and that, but we don't really know our denominator. And because it's the asymptomatic people who will never get tested, and probably, but even the ones who we know potentially have it. We don't have that. So we just need to rely on our testing to figure out who's at, and those people can quarantine themselves even further. So that will really be the key the next week or so. But I would say at least the next month will be very important. Unfortunately, we have some hotspots that are really telling us, New York in itself is telling us what the grave consequences can be if you're not well prepared. Now, rest assured, a lot of the predictions that people are making are based on the fact that if we didn't do anything, but the fact that we're practicing social distancing and we're doing testing and all these other things we're trying to do and shutting things down will hopefully impact that curve. Now, that's why it's important for, as you can see today, these young people that are not believing in this and kind of doing their own thing, those are potentially at risk.
That is the issue. Like, I think we're not seeing what people are going through. We don't really have an idea of what somebody suffering from this virus is going through. Is there like a worst case scenario that you've actually experienced or seen or heard of that you want to make real for us as far as sharing?
Well, I just heard from a friend of mine in New York that their residency program is 10 residents, and they've had 8 out of the 10 test positive. So these are young, healthy people who are in the workforce that are unfortunately, just imagine your whole residency program is decimated. Those are 8 people that can't practice and help, but intentionally you have 8 young individuals in the prime of their life with a deadly disease.
Well, I remember you talked about like the lungs, that this is considered a lung killer, or I don't know what the nickname of it is, but the impact it has on the lungs. So you've seen some images of that?
Oh yeah, totally. I mean, it's a natural. A lot of times, and if you actually look, a lot of people are actually making the preliminary diagnosis based even on a chest X-ray or a CAT scan. And
have you guys don't know yet what the impact will be long term on that? For the
no, that's the other problem is unfortunately, the asymptomatic patients who have recovered, we don't know what the long-term impact is because these are young, healthy lungs. And so what happens later on in life? It's kind of like the whole 9/11 scenario, right? Where people were jumping in and helping.
Yeah.
And then long-term, you see, oh my God, the impact of some of those things that they were exposed to, what did that ultimately end up?
Is this similar to TB in any way?
No, it's not, because TB is a very slow growing, and that takes months to have its impact. Once you have an exposure, it takes a long time for you to actually, and unfortunately, TB, we have treatment. So we have adequate testing and we have adequate treatment. This, no matter what the politicians are saying, everything that's been reported as form of treatment is anecdotal. Wow. And as you know, in science, you have to have controlled trials to show the cause and effect is real rather than anecdotal. So what may work for your aunt or uncle, and we've all had scenarios where your aunt and uncle's like, well, I just put this cream on and I feel better. Well, for you, but I can't reproduce that in anybody else. So if I can't, the reliability and the reproducibility has to be established before we can take accepted term. Now, that doesn't mean we can't use some of these things, because even if they're showing promise, we should be using them, but I wouldn't necessarily count on it.
Wow. Any advice on how we should be handling the social distancing and self-quarantining that,
I mean, I think we all know what we do. Unfortunately, your family is exposed to you or you're in proximity to them, so that's okay, but in the immediate household, but I think, you see examples of people crowding parks. That has nothing to do, because if you use the restroom in the park, or you touch the front gate of the park, or you do all these things, you're just exposing more and more people. So it's nice to be outside, but I think you have to use caution and make sure that you do it in a way that you're kind of self-distancing away and not impacting others.
And also keeping routines, right? Like keep exercising, go outside, go hang out with your family, play games. Don't just.
Well, this is your ballpark, This is your area where you have to keep your mentally strong, and you have to rely on, routines and maybe adapt some new things in your life that you weren't able to do. And, that long list of things that you had to do, maybe this is an opportunity to check some of those things off if you can. Because otherwise, like you said, these close quarters aren't helping people either in terms of because we're all different in the way we live our lives. Some people are introverts, some are extroverts, and I'm sure the extroverts are hurting, not being able to be outside.
Exactly, and I'm sad to hear that all this, social distancing or separation, for some people, they're stuck with a physical abuser, or their domestic violence is on the rise, and child abuse is on the rise, and this is putting a toll on people's mental capacity and stress response. So it's a time to really take care of ourselves.
Oh, I can imagine those are exacerbated. Some of our social implications from this are probably expanding. And as you know, right away, domestic violence, and child abuse, these impact the ERs too, and these impact our social stressors and the things that we want to do. So
yeah, definitely. Well, I know you're really busy, so thank you so much for taking the
no
time
problem.
and educating us.
All righty.
Thanks, Haroon. Bye-bye.
Bye. Stay safe.
Thank you. You too.